The patients that I see, I always describe them as too poor to afford medical care, but too rich to qualify for Medicaid. And so these are the working people who are paying for things. It's very difficult for them as it is, and the healthcare legislation that we're discussing would be make it very hard. However, we've always taken care of patients. We will always take care of them. We won't let somebody lay on the floor and die. But it's much easier when there is resources there and we can do a better job. And so I just hope that we as a society will understand how these people live every day, like how all of us live every day, not knowing whether or not we'll be able to get care or whether or not my child can. It's gotten to the point that it's so political that you forget there are real people there. They're actually people one-on-one who have a real life experience with every policy that we're making and every decision that we're making. So I think the access to care really does matter. I've seen over the last couple of years just how much has been improved just in the last 5 years. And so I just hope we don't go backwards.
Yeah, you know, at the foundation, one of the areas that we're very focused on is access to care. We believe that everyone in America should have access to high quality, affordable, comprehensive health care, that people with pre-existing medical conditions shouldn't have to pay more. That's part of our concern over this bill. The other has to do with Medicaid. And I think there's a misconception in Medicaid that Medicaid is just something for poor people. Medicaid, yes, I'm a pediatrician, and almost half of all children receive care through Medicaid, but Medicaid also pays for 60% of elderly people in nursing homes. Medicaid provides for people who have disabilities. And the idea that it could vary greatly by state in terms of how those dollars are allocated is very concerning. And that states could decide that, well, people who have asthma may have to pay a little more for medical conditions. A child with a birth defect may pay more. There may be lifelong caps. We don't know because it takes away this guarantee across the nation that everyone should have access to essential health services. Yeah, anyone who's sick and dying who comes in is going to be cared for, but that's not what it's about. It's about prevention. It's about having a doctor, having a health system that works for you and your family, and not having to worry, not saying, well, we're not going to get those teeth fixed because we can't afford it. I mean, it's all of this stuff, and it looks like this bill is just slipping through. It's very
in Alabama,
concerning.
you know, in Alabama today, if you make over $250 a month, you make too much to qualify for Medicaid. And we talk about Medicaid as though it's, you know, it's for these rich, lazy people. It's not.
Yeah, no, you know, when you talk about this bill, I mean, I think the first thing that we have to come to some consensus on, and shockingly, there's still debate about this, is that access to care results in tangible health benefits. That it results in longer lives. There's still debate about this. That I think is largely politically driven. There was a piece that Gowande had in the New England Journal recently that sort of you know, really frames the debate, I think, well, and essentially shows that having access to care helps you live longer. It helps you deal with health problems better. It prevents bankruptcies, and so. This bill is worrisome. I'm not a health policy expert, but Sarah Cliff had a nice piece in Vox recently where she basically says that this Graham-Cassidy bill is the most radical repeal and replace bill that the Republicans have put forth for Obamacare. Not only will it get rid of the individual mandate, cut Medicaid, get rid of marketplace subsidies. The current sort of guess is that 32 million Americans will go uninsured, you know, in the coming years. I think by 2026. That's awful.
You know, we were very encouraged by some of the bipartisan efforts. You know, the idea that both parties could come together and try and improve on the Affordable Care Act is is I think something that makes sense and that the American people would like to see happen. You know, again, being out in rural Kansas, they're really worried about rural hospitals being able to survive if there are cuts to Medicaid. I mean, you see that greatly.
Every day, every day. And it's stressful. It adds stress to the community. When you talk about the things that better health allows kids to be better prepared to go to school. They learn better. Elderly people can stay in their homes longer. The workforce is healthier. We want to bring work and economic opportunities. You need a healthy workforce. And how do you do that without a healthy society?